Hi guys, in this video I will be discussing the second part of NSAID, that is the toxicity and the clinical uses of NSAID. So let us begin. So guys, the first toxicity which we are going to discuss is the gastric upset. Actually, these drugs cause abdominal pain, dysplegia, nausea, vomiting, gastric ulceration, and upper GI bleeding. Okay, and yeah, gastric ulceration and GI bleeding are the most common adverse effects from the therapeutic anti-inflammatory doses of aspirin. Okay, so this aspirin should be taken with food and large volumes of fluid to diminish dyspepsia. Okay, and elderly patients are at greater risk for serious GI event. Okay, but aspirin is used for the primary and secondary prevention of cardiovascular events. Why? Because it is a anti-platelet drug. Okay. Yeah. Now, to prevent this gastric upset toxicity, we should, give the NSAIDs with the combination of a prostaglandin derivative. Example is the misoprostol, proton pump inhibitor like omeprazole, lansoprazole, and pantoprazole, or H2 blockers, histamine 2 blockers, famotidine and ranitidine. Okay. However, a preparation combining diclofenac and misoprostol decreases upper GI ulceration, but may result in diarrhea. Now we will conclude the toxic effects, that is the gastric events, upset that occurs due to the use of NSAIDs. Okay, so thus NSAIDs are all gastric irritants and can be associated with GI ulcers and bleeds. Although the newer agents selective COX-2 inhibitors. Okay, so remember guys, we have two types of enzyme, COX-1 and COX-2. Um, whatever we have discussed till now, it applies to the non-selective COX inhibitor. Like they will inhibit both COX-1 as well as COX-2. But this COX-2 selective inhibitor, they will cause less GI irritation than aspirin. Okay, which is a irreversible inhibitor of COX. Okay. Now, for example, the expensive selective COX-2 inhibitor like celecoxib is probably safest for patient at a high risk of GI bleeding, but may have a high risk of cardiovascular toxicity. Okay. The GI effects of endomedicine may include pancreatitis. Yeah. Now this analgin usefulness is limited in the condition like granulocytosis, erosions, and GI bleedings, meth, meth, methemoglobinemia, and hearing impairments. Moving on to the renal toxicity. So, the renal toxicity includes renal acute failure and interstitial nephritis, nephrotoxicity, hyperkalemia, and proteinuria, which is caused by the overdose of the paracetamol or the acetaminophen. Okay. Now, this renal papillary necrosis has also been observed with using endomethacin. Okay, because NSAIDs are cleared primarily by kidneys, these drugs accumulate more rapidly in geriatric patients. Now, what do we mean by this geriatric patient? These are patients which require a, systematic care about any disease. Okay. Now, COX-2 or the COX-2 inhibitors, they are also not the kidney sparing. Okay. Yeah. Now, as I have discussed earlier, aspirin is a anti-platelet drug. Okay. So it will inhibit the platelet activation and aggregation, therefore causing a severe risk of bleeding time. For example, it will increase the PT and PTT, prothrombin and the partial thermoplastin time. Okay. For this reason, aspirin should not be taken for at least 1 week prior to surgery. Okay, and it is very essential to check occult blood in stool in case of a long-term NSAID therapy treatment. Now, coming to the third toxic effect of the NSAIDs, these are the hypersensitivity reactions. Okay, approximately 15% of patients taking aspirin experience hypersensitivity reactions. Okay, and the common symptoms of allergy include urticaria, bronchoconstriction, asthma, and angioedema. Yeah. Now the fourth toxic effect of the long-term use of the NSAIDs is the thrombosis. Okay, and when we take the highly selective COX-2 inhibitor like celecoxib or all the drugs which end in the suffix coxib, uh, they cause the higher incidence of cardiovascular thrombotic events, myocardial infarction, and stroke. Okay, than the non-selective drugs which can be fatal. Okay, and the risk may increase with the drug dose and the duration of use. Okay, so avoid taking NSAIDs in chronic terms. Yeah. Now this COX-2 highly selective COX-2 inhibitors like rofecoxib and valdecoxib, they cause an increased increased risk of myocardial infarction and stroke. Okay. Now, why do they cause this risk of myocardial ischemia and stroke? Because they inhibit the cyclin production by the endothelial cells. Okay. So, you know, this prostacyclin promotes the vasodilation and it inhibits the platelet aggregation. Okay, so thus by inhibiting the prostacyclin production, it will cause the this factors which are important for the development of a myocardial infarction. Next toxic effect of the of the NSAIDs is the salicylism. Okay, and this occurs due to the higher dose of aspirin. Okay, the symptoms include the ti- tinnitus, vertigo, headache, hyperventilation, and respiratory alkalosis, nausea, vomiting. Okay, and this is called as a salicylism. Okay, and at a very high dose, the drug causes metabolic acidosis, dehydration, hyperthermia, collapse, coma, and also death. Okay, and the ingestion of at least of as little as 10 gram of aspirin can cause death in children. Okay, so never use aspirin in children. Instead, give paracetamol. Yeah. Now this Rare syndrome is a rare, serious syndrome of rapid liver degeneration or fulminant hepatitis and encephalitis, cerebral edema in children which are treated by aspirin during a viral infection. Okay, so salicylates must be avoided in children and teenagers. Okay, with a viral infection, like va- varicella, chickenpox, or influenza to prevent Rett syndrome. Okay, and now instead of giving aspirin to the children below the age of 20, we should give paracetamol as it prevents the Rett syndrome. Okay. Now moving on to the aseptic meningitis, which is seen particularly in patients with systemic lupus erythematosus and fluid retention have been reported using ibuprofen. Okay, and the concomitant administration of ibuprofen and aspirin antagonizes the irreversible platelet inhibition induced by aspirin. Okay, so thus never give ibuprofen and aspirin at the same time, as it may limit the cardioprotective effects of aspirin. Okay, Furthermore, the use of ibuprofen concomitantly with aspirin may decrease the total anti-inflammatory effects. Okay, so never give ibuprofen with aspirin. Okay. Now, coming to the aspirin, it is a non-selective drug which inhibits both cyclooxygenase isoforms and thereby decrease prostaglandin and thromboxane synthesis throughout the body. Okay, and the major difference between the mechanism of action of aspirin and other NSAIDs is that aspirin acetylate and thereby irreversibly inhibits cyclooxygenase, whereas the inhibition produced by other NSAIDs is reversible. Okay, this is important, guys. Aspirin actually inhibits the COX-1 and COX-2 irreversibly. Okay, whereas other enzymes they will inhibit the COX-1 reversibly. Okay, now the irreversible action of aspirin causes longer duration of its anti-platelet effect. Okay. Now some pharmacokinetics of the aspirin. So absorption, it is rapidly absorbed from the stomach and the upper small intestine, and is hydrolyzed to acetic acid and salicylate by esterases in the tissues and blood. Okay, and the serum half-life is about 15 minutes. Okay, and the dose. Now for anti-inflammatory therapy, the required dose of aspirin lies above 3 gram daily. Okay, for treatment of ordinary pain, overdose of 500 mg is needed. At low doses, it, it, it is used as an antiplatelet drug. Yeah. Now let us discuss about the toxicity of aspirin. So, alkaline, alkaline, alkalinization of urine increase the rate of excretion of free salicylate. Okay, and the adverse effects of this are the gastric upset, intolerance, and gastric and duodenal ulcers and GI bleeding, hepatotoxicity, asthma, rashes, and renal toxicity. Okay, and the anti-bleed action of aspirin contraindicates its use in the patient with hemophilia. Hemophilia is a blood disorder in which the platelet are they are they are unable to make clots. Okay. Yeah. Now, acetaminophen or paracetamol, it is a analgesic and antipyretic effect. It lacks anti-inflammatory or anti-platelet effects. Okay. Mechanism of action: the drug is a weak COX-1 and COX-2 inhibitor only in the peripheral tissues, and it also inhibits a third enzyme COX-3 in the CNS. Okay. Thus, acetaminophen inhibits prostaglandin synthesis in the CNS. This explains its antipyretic and analgesic effects. Okay, so now coming to the dosage plan of the paracetamol. So 0.5 to 1 gram up to 4 times daily. Okay, for the acute pain, we should give 325 to 500 mg 4 times daily and proportionately less for children. Okay, and injection of 15 gram of acetaminophen may be fatal, death being caused by the severe hepatotoxicity, sometimes associated with acute renal tubular necrosis. Okay, and the doses greater than 4 to 6 gram per deciliter are not recommended. Now, coming to the clinical effects of the acetaminophen or the paracetamol. It has good analgesic efficacy in toothache and headaches, but is of less use in inflammatory and visceral pain. Okay, and yeah, it is a drug of choice for children with viral infection or chickenpox. Recall that aspirin increases the risk of Ray syndrome. Okay, thus paracetamol is preferred to aspirin in children with viral infection, and it is preferable to aspirin in patients with hemophilia or a history of a peptic ulcer, and in those in whom bronchospasm is caused by the aspirin. Okay, so when this paracetamol or acetaminophen drug is given in overdose, it will cause hepatotoxicity, and the drug of choice is the acetylcysteine. Okay, and people who regularly consume three or more alcoholic drinks per day are at increased risk of acetaminophen induced hepatotoxicity. Caution is very important in patient with any type of liver disease. Okay, so this COX-2 CERT2 inhibitors, they are used in the if the patient has a more mucosal injury or GI effects like ulceration, we can use these drugs, but these drugs do inhibit the prostaglandin the prostaglandin synthesis in the endothelium. Thereby, they do not offer the cardioprotective effects. Okay, so guys, that is it for today, guys. Thank you for watching, and remember to subscribe.